Hey besties, before we talk about the 5 interview questions and answers, if you are going for any NHS interview, familiarize yourself with 3 things. Number 1, NHS core values. If you don't know what I mean, I'm going to be linking up a video where I talked about the core values of the NHS, because you should not be going for an interview with the NHS without knowing the core values in their constitution. Number 2, familiarize yourself with the STAR method. If you've been on this channel long enough, you would know that STAR stands for situation, task, action, and result. And it is the number 1 way of answering any behavioral interview question. If you don't know what I'm talking about, I've linked up another video. Number 3, ensure you have ample examples to cite. Now, the reason I've started this video like this, telling you the 3 most important things, is I can give you as many interview questions and answers as I can, but if you familiarize yourself with those 3 things, any NHS interview is going to be a breeze. So you know their core values, you know how to answer a behavioral interview question using the STAR method, and you have enough examples. Once you've locked this one, I tell you, no matter the question they would ask you, even without this guide, you would know what to say. Now that that's out of the way, today we'll talk about 5 interview questions and answers. And besties, you know how we do it. You know me, I don't have time for long introduction. You already know that my name is Ada, aka the Legal Pepper. You also know that I want you to please like and subscribe. Now, if you're new here, how I do this thing is to talk about the question, talk about the likely perspective of your interviewer, and give you my own sample answer. Not for you to cram, because even I do not cram it, but for you to have a general idea of the kind of things you're expected to say when you are asked that question. So now, question number 1 is, why do you want to work for the NHS? Now, this is a very basic question, because if you are applying to the NHS, they want to test your intentions as to why. Now, you should give a genuine answer that demonstrates a genuine intention for wanting to work with the NHS. Now, in your answer, ensure to list out NHS core values. Now, you may not even necessarily list out the core values. It would make sense to at least highlight, even if it is 1 core value. Also, in answering the question, if you can, it could also help you to highlight a part of the job description, because they just want to see your motivation and commitment to the mission and the values of the NHS. So now let me show you my sample answer that you can choose to screenshot if you want. I am passionate about working for the NHS because it embodies values that resonate with me, such as providing high quality care for everyone regardless of their background. I admire the NHS's focus on teamwork, innovation, and improving patient outcomes. Being part of an organization that has such a profound impact on people's lives is something I am very motivated by. So now, as you can see, I have listed a core value of the NHS. Now, you don't have to list the one I've listed. Once you know these core values, you can just pick anyone that resonates with you and share as your reason why you want to be in the NHS. Now, question 2, how would you manage your workload in the NHS? The reason they ask this question is because they know that working in healthcare is quite fast-paced, and they just want to test your ability to prioritize tasks. This is a question that in a lot of my healthcare interview question and answer, it keeps coming out, because they literally want to test that. Before showing you my sample, you can even answer this question by talking about color codes, because some people color code their task such that the green task is a task that does not require urgent attention. The amber task is quite neutral, while the red task requires urgent attention. So some people use that color code to determine the kind of task they should do at a particular time. Now, if you use this analogy, it shows your interviewer that you know what you're talking about. So you can answer by saying that you color code task depending on the priority, whether it is urgent and important. Obviously, that's going to be the red color code. Not urgent but important, that's going to be amber. then neither urgent nor important, that's going to be green. That is a way to answer this question. Or you can answer it like this. To manage my workload in the NHS, I would prioritize tasks based on urgency and importance, ensuring that critical patient needs are addressed promptly. I would utilize effective time management techniques such as creating daily schedules and setting clear goals. Additionally, I believe in open communication and teamwork, so I would collaborate with colleagues to share responsibilities and provide mutual support. Regularly reviewing and adjusting my workload would help maintain balance and ensure high quality patient care. Now, question 3. How would you deal with a difficult patient? They keep asking this question because they know that when you're working with the NHS, or in fact working everywhere, you would most likely encounter a difficult client, and they want to know how you are going to be able to navigate such difficult scenarios. So let's go to my answer. When faced with a difficult patient, I would approach the situation with empathy and patience, seeking to understand their concerns and perspective. I would actively listen to their grievances, acknowledging their feelings and validating their experiences. Remaining calm and composed, I would communicate clearly and respectfully, aiming to de-escalate the situation and build rapport. If necessary, I would include other members of the healthcare team for support and guidance. Ultimately, my goal would be to address the patient's needs while maintaining a safe and supportive environment for everyone involved. Now, in this answer, to me, the most important part that if you forget anything, please don't forget, is that last line, which emphasizes the fact that your focus will still remain on your patient's needs. Because as a healthcare professional, you are supposed to be patient-centered. And once you focus on the patient, then that shows that you are going to make a good employee. So besties, before we go on, if you want my interview guide ebook where I talk about various questions and answers like this, or you want me to just revamp your CV for you, just click the link in the description box to see all my services. Now, to the fourth question, why is confidentiality important in the NHS? This is a given. Like, let's not even talk too much about this question, because why won't confidentiality be important? Confidentiality is paramount in the NHS to uphold patient trust, privacy, and dignity. It ensures that patients feel safe and comfortable disclosing sensitive information, which is crucial for accurate diagnosis and effective treatment. Respecting patient confidentiality also upholds ethical principles and legal obligations, safeguarding patient rights and maintaining professional integrity. Furthermore, confidentiality fosters a culture of trust between healthcare providers and patients, facilitating open communication and collaboration in delivering quality care. Now, in question 5, what do you understand by equality, diversity, and inclusion, and why is this important in the NHS? Now, for this question, this is a perfect way for you to tell them that you know NHS core values. Hey besties, I'm editing now, and I just thought to make more emphasis on this equality and diversity question. Now, when you hear that question, it's not just about skin color. So it's not just a question that is asked because maybe the client base are filled with people from minority groups. No, remember that your client would most likely have 1 or 2 disabilities. These disabilities already make them prone to experiencing inequality, discrimination, and exclusion. Now, there are some clients that are doubly or triply prone to discrimination. For instance, a client that has disability then is also from a minority group, like an ethnic minority group, or a client that is not heterosexual, which would make the person prone to receiving discrimination, or maybe a client that is elderly, which can place them in a situation where they can be prone to receiving discrimination. So this is a question that when they ask you, you should use the opportunity to let them know that you stand against any form of oppression, racism, homophobia, transphobia. Like, you don't stand with that. So let's go on. So to answer this question, this is what I'm going to say. Equality and diversity refer to the principles of treating all individuals fairly and respecting their differences, including but not limited to race, ethnicity, gender, sexual orientation, age, disability, and religion. In the context of the NHS, equality and diversity are essential to ensure that everyone has equal access to healthcare services and experiences equitable treatment regardless of their background or characteristics. Embracing diversity enriches the NHS workforce, bringing together varied perspectives, experiences, and skills that enhance patient care and organizational effectiveness. By promoting equality and diversity, the NHS fosters a culture of inclusion where every individual feels valued, respected, and able to thrive, ultimately improving health outcomes and patient satisfaction. Now, obviously, this answer is a lot, and you don't have to make your answer like this. To answer the question, just ensure that you give a little introduction to what equality, diversity, and inclusion mean to you. Just make them understand that you understand the Equality Act, you understand what it means for a person to have protected characteristics. Now, once you've done so, you can make them know that you understand that this is one of the core values of the NHS, and in fact this is even a legal duty. Now you can say any other thing you want to say, but by addressing those main points, you've just told them that you understand what equality, diversity, and inclusion mean and how important it is for the NHS. So besties, those are the 5 questions for your NHS interview. If you've liked any of the points and you like videos like this, please, I want to see like, and I'm going to link you up to a behavioral interview question video. So if you ever struggle with the STAR method that I talked about earlier, this next video, do not miss it. And do well to stay subscribed if you've not done so already. So my besties, I'm going to see you next time. Until then, stay blessed, remain happy, and bye.